Hey, my name's Anna Juarez. This is my capstone proposal for Midwestern State University for the graduating class of 2023 for our BSNs. I want to give a big thanks to our professor, Christy Bowen, for all your guidance this semester. If you guys have any questions regarding my proposal, please reach out. I haven't explicitly put it out here, but my proposal is over CLABSI prevention. We want to reduce the numbers of CLABSIs. My presentation, we're going to hit quite a few objectives. We're going to start out with the rationale, why CLABSI infections are an important part of our nursing, why we want to limit them or what they contribute to. We're going to talk about the background, really why they're super significant and what the numbers show. I'm going to give you my official problem statement, stating what I want to implement and why. We're going to talk about the resources that I found and what information I found relevant and why it's important to this proposal. We're going to talk about how I plan to roll out my plan or my proposal, how I'm going to implement it, how we're going to evaluate whether or not it was worth it or whether or not we are seeing a change in statistics. I'm going to talk about dissemination and how I plan on getting my information out to the public. And then we're going to wrap back in and just hit those major important bullet points one more time and wrap it up. So central line infections are CLABSIs, central line associated bacterial infections. Those are infections that are caused specifically because a bug or bacteria entered in through a central line of one of our patients and causes an infection. The importance of this, or what's significant, is that there are serious consequences to these types of infections. They contribute to sepsis, organ failure. They significantly increase the chances of mortality, significant morbidity, prolonged hospital stays, and healthcare costs. What all that means is there's a hit to the patient. If the patient was already battling different infections and maybe they were clearing up, maybe they weren't, and then they were hit with something else went wrong, maybe they got a UTI or they fell, and then they get a CLABSI. It's just another thing tacked on to that patient, and when they're suffering from comorbidities already, it just significantly increases the chances of mortality, and that's definitely not what we want. We don't want to push back progress. We want to promote progress. It's a hit to the statistics. Many units, they keep track of CLABSIs, how often they're occurring, and try to make preventative steps to prevent them because they do negatively contribute to patient outcomes. It's also a hit to the hospital. A lot often, whenever a person suffers from a CLABSI infection that was not present upon arrival, the hospital will take over for hospital or healthcare costs. So that's coming out of our pockets or the hospital's pocket, which those are our employers, and we want best for everybody. We want the best for the patient, we want the best for the nurses, and the best for the hospital to keep everybody happy. Our goal specifically is to reduce CLABSIs, reduce the incidence of sepsis and organ failure, reduce morbidity, shorten hospital stays, and decrease healthcare costs. Let's make everybody happy together. Background on CLABSIs. According to the CDC, there are 30,000 CLABSI infections annually. Those infections contribute to 5,700 deaths annually and $2 billion in healthcare costs. What that means is those infections were likely, we could have prevented them had we been more cautious. Maybe not in every instance, but in a lot of them, nurses or the patients accessing them, hygiene, could have decreased the chances of those people dying or even contracting the infection initially. The Journal of Association for Vascular Access published an article or a study completed in 2019. And this study discussed the use of Curo caps or disinfecting caps for needleless connectors. Along with their study, they reported that CLABSI infections also increase the risk of mortality by 12 to 25%. When those patients are already suffering from other comorbidities, that 12 to 25% can make or break one of those patients. So we definitely want to be on their side and be proactive and do what we can to decrease mortality rate and promote better patient outcomes. My official problem statement. This is kind of the basis for the rest of the presentation. It states in hospital patients with central venous catheters, does combining cleaning techniques compared to single cleaning approaches affect the prevalence of CLABSI rates? So a lot of times hospitals or entities, they'll have one intervention or one policy that they require for access to a central line. And that is, from what I've seen, scrub the hub, which is scrubbing around the needleless connector for 7 to 15 seconds before accessing. Or I have also seen the Curo caps. The Curo caps, you want one placed on after you're accessing it. And then when you go to re-access, you just take that Curo cap on, you access immediately, and then when you're done, you just put a brand new Curo cap. That Curo cap has alcohol underneath it, so it's supposedly cleaning the catheter consistently until the next access. My proposal is that we combine both of those. So I know nurses are always busy and it might sound like a whole extra step, but our patient outcomes are definitely worth it, and so is their health. So I feel like it's important that we reduce those numbers and do what we can to contribute to them. I had lots of resources that I found that I felt were very relevant and gave some great information. Um, I found that CLABSIs, we kind of already discussed, cause negative patient outcomes or contribute to negative patient outcomes by increasing morbidity, mortality, and healthcare costs. Something I didn't specifically speak on earlier was, if somebody contracts an infection in their central line, their hospital stay is lengthened, and then it might also contribute to delirium. That patient's there in that room for a whole nother week being treated for an infection, and they have already been there for 2 weeks for whatever reason. It gets hard, and then once they become delirious, things can keep domino effects affecting downwards, and we don't want them to trend down. Again, we want them to trend up and make progress, not work backwards. I found that the CDC, their recommendation for accessing central lines is to scrub the hub with an antiseptic solution, so like an alcohol prep. That was their official. I found studies that claim that the disinfecting caps or Curo caps can significantly reduce the chances of contracting eclampsia. However, I did not find studies that used both. So it's either one or the other. One thing that I found really important was that human factors like staff compliance and education can really contribute to whether or not any of these interventions are going to work. So we need to make sure that staff is educated and that everybody's following protocol. Multiple infection prevention strategies are definitely needed to reduce CLABSIs. I found a few sources that said that, just nobody's really taken the wheel and steered us that way. So how's this all going to work? It might be a big deal, but we'll get through it, guys. We have our whole plan, implementation plan set out right here. We're going to start off by gathering data. We're going to gather data from the Hospital Consumer Assessment of Healthcare Providers and Systems and Quality Control Basis. We want to make sure that all of our data is legit and recent. I want data from the last 6 months to a year. That's very important because we don't want numbers from 2002 when it's not really relevant and can kind of skew our results in the end. We want something that's recent that we can compare to. So it's important that we have good data from pre-intervention to compare to post-intervention. We are going to foster a team. So our team is going to be very important because we're all going to contribute our individual knowledge, our individual specialty knowledge. We want administration. Administration is such a big deal because they know about numbers, they know about costs and budgets and where we stand as a hospital regarding CLABSI infections. They're just going to be a big part of this plan. We want nurses. There's so many different types of nurses that use central lines. So we want all of you guys, dialysis, ICU, tele, all of you guys have access to these ports, and it's just very important that we get everybody's input so it's as unbiased and transparent as possible. We want doctors, anesthesia. Anesthesia places central lines, and they're often the first people to access them. They'll take off lines that are connected to the central line. They're just going to be very important and can provide some great feedback. And then we want nursing informatics. You guys, this is your cup of tea, so come join our team. We are going to identify a target population. That population is specifically patients with central lines. We're going to be helping those guys. We're going to establish a protocol. Our protocol is going to be the combination of both of those interventions. We are going to remove the old Kuro cap that was placed by the previous nurse or the previous access. We are going to then scrub the hub for 15 full seconds. Make sure there's no buggies or bacteria hanging around that hub. We can access it without touching anything with that central line or that needleless connector. You can do what you got to do, and then you're going to replace that Kuro cap before you're done. So we're doing the Kuro cap and we're doing scrub the hub together. We are going to educate. We're going to educate everybody on our protocol because it's important. We're trying to make progress here. We're trying to increase positive or better patient outcomes, decrease the chances of mortality. We're going to explain to our patients why we're going through all this trouble just before we flush that central line. We're going to tell them why it matters, what it puts them at risk for, that we have to go in there and do that. We're going to educate the nurses on what to expect, why we have to go that extra mile for these patients. All stakeholders. We're going to educate the board of the hospital and let them know, hey, you might see a little bit of an increase in budget, but this is why I think overall it's going to make a difference positively for our entity, for our hospital, and hopefully everybody's happy, happy, happy. Might meet a little resistance initially, but we'll get through it, guys. Education. Education is essential in safeguarding the successful implementation of this project. We want to build support for the project and ensure that everybody involved in this project understands their role. Education is going to be provided in lots of different means. We're going to kind of individualize education based on who we are educating and the reasons we're educating. So our patients, we want to again let them know how to have proper hygiene for their central line, how we can best prevent infection. We want to let them know the risks of those central lines and what risks they are put at when we're not properly cleaning them. We want to let them know, hey, sometimes infections occur, but this is how we're going to help you most. We are going to educate the nurses. We're going to teach them proper line maintenance, proper line access. We're going to tell them or teach them the importance of adhering to the protocol. If we're not really following the protocol, we are not able to accurately see whether or not it's going to benefit our patients. And we also want those nurses to be teaching our patients along with their care. We want to make sure that they are explaining everything that they're doing and why it's important. We want to educate leadership because leadership's going to want to know, why are we doing this? We want to let them know what we expect. We expect better patient outcomes. We expect less infections associated to central lines. And we expect lower hospital costs that we are paying for out of pocket, because if we have less infections that occurred after they get here or these patients get here, then it's going to save us money. Evaluation. So we talked a little bit about gathering that data pre-intervention. We are now, after we put our interventions in place, we're going to evaluate whether or not they were worth it, whether or not we're seeing or making progress. So we're going to compare. We're going to take those standardized surveys. We're going to audit the charts. We're going to see whether or not collapses are still occurring at the same rate, because we want to know if we made a difference. We want to make sure that we are getting checked off on access, just almost like an IV dressing change. We want to make sure people know how to access these ports correctly. So we'll be monitoring, we'll be auditing, making sure that people are following protocol. And then we're also going to use the standardized data collection and arithmetic methods to get some information to see how exactly we did and the great progress that we made for our patients. Dissemination. So once we get all of our information and we decided that everything goes great, the protocol is good, we are going to send our information out. We're going to have healthcare conferences with the hospital, with the board. We're going to let them know how combining these techniques, these cleaning techniques for collapse or for central lines, affects patient outcomes. We'll write up an academic journal and show exactly what we did, list our barriers. We're going to list our population, show how the numbers trended throughout the entirety of the proposal. While we were doing that, we'll use social media. We'll let people know through leadership, management. We also want to, we can create a module for nurses. That way new hires are able to learn. Maybe quarterly or biannually, nurses are required to repeat online modules for contact hours, and these can count for education. But we'll definitely spread the word on the benefits of combining cleaning techniques for the reduction of CLABSI infections. So I want to talk a little bit about why barriers and constraints are important to this proposal. One is because sample sizes are not always the same. You might go through a period where you have lots of central lines that you're accessing, and then you might go through where there's just random, not so many. So sample sizes might be limited at times, and that can definitely be a barrier or constraint. Time limits, we don't have forever to do this proposal. So time limit could limit how much progress we see in that amount of time. Shortage of resources, hopefully not, but should we not have the resources such as educating everybody or spreading out our information. Hopefully we're not short on churo caps or alcohol preps, but shortage of resources could limit us in our success. Resistance on the unit, definitely there's always people that might feel that changes are not necessary. But hopefully through leadership styles and management communication, we can move past that and make progress for our patients. Inaccurate data, falsely charting or charting that everything was done perfectly when it wasn't, or not even done at all, or just missing numbers regarding CLABSIs can definitely skew results and can be a barrier. So, summary, we made it. Again, CLABSIs, they're just not good for anybody. They hit the patient, hit the nurses, hit the hospital, hit the numbers, the budget, the progress, negative impacts on patient outcomes, which is really the focus of all this. We want positive patient outcomes. Each cleaning technique reduces the chances of CLABSI. Scrubbing the hub reduces, it's proven. Churo caps reduces the chances, it's proven. Using both together simultaneously can significantly, I propose, significantly reduce the incidence of CLABSIs, which is our goal to promote better patient outcomes. Not only will their recovery be faster, their hospital stay will be shorter, they'll be glad to get where they're going, and we can make room for somebody else. Thank you guys for coming along with me through this. I hope that I can inspire somebody to take the extra time to clean that central line as best you can and give your patient a better chance of faster recovery and getting home, staying healthy. Y'all take care.